Hi guys, in this video we're going to talk about coronavirus and us as a massage therapist preparing to come back to work. But check out the new intro. Let us know what you think.
Hey guys, welcome back to another BusyHive video.
So we want to show you how to get prepared for the session, what to do in the case seeing the client coming back after all this lockdown. What do you think?
Personally, I think, Chris, you may be overthinking it just a little bit.
Well, I got gloves, I got mask, I got apron. I'm all ready.
And you look very scary.
Grrr.
Hey guys, let's break this down and take it a step at a time. I'm going to remove this so you can hear us.
Check this out, by the way. Show it off.
Yeah.
Check this out. Homemade with the bees. Oh yeah.
Gotta be done.
So guys, we had horrible time. What's happened in here? We had lockdown, we had a virus, you had to stop working, and it's terrible for financial reasons, for reasons because we love what we do.
Exactly. It's been very, very lonely not seeing clients and knowing that you can help someone out there and you're not allowed to go near
And
them.
I actually realize and imagine this is us thinking and what clients think is the same. I realize how I need a massage.
Yes.
How I need a treatment, quite big. So guys, 4th of July, there's an idea from government that the risk is coming down and we can start working. Start open up the clinic with the new lots of guides and regulations what we need to do.
It can be really overwhelming as well, guys, that this epidemic's been out there. It's really scary. People have been dying. It's gonna be scary to finally leave your front door and go outside. Some of you may not have been to the supermarkets or anything and stayed inside. Maybe you've been shielding from it. So we just need to break things down to calm everyone down and make it an enjoyable experience again.
And give you a couple of ideas what we think we can use, we can add or don't. What's important and what's not. So
Yes.
let's talk about it. So hopefully this time wasn't wasteful for you. There was lots of online stuff, you looking after yourself, done lots of courses, catch up on the books or so on. There was lots of stuff you could do. Work on your marketing, your websites, things like that. So it's time now possibly contact the clients, see how they are, offer some Zoom calls, offer them stretches. There was lots of possibility. Maybe you haven't done anything.
And that's okay. That's fine. But it is getting to the time now, whether you decide to open your clinic or not, it's a nice idea to make contact. Make contact with your clients. Let them know that you're still here and check in on them and see if they're still okay. And let them know what your plan is going forward, whatever that may be.
It's good to include some policies, how you open, how you're gonna see them, and we're gonna want to talk in here point by point to give you some ideas.
Yes. So first of all, make contact with your client. That could be phone or Zoom or Skype or whatever video
Email.
call, WhatsApp call, whatever. Just make contact with them. See how they are. See if they've been ill, if they want treatment, they might not. They might just want a friendly chat. I mean, some of our clients just get more out of the talking, I think, than the treatment sometimes.
And it's good to touch the base, how they are, what they need, kind of plan ahead, work what you need to do. If you talk to them, let's say they still have a shoulder problem or this and that, even with the new guidelines and how you want to prepare clinic, you can already visualize this. What you're going to do and how you're going to talk them through.
Yeah, it's even more important now to make a plan of what you're going to be walking into or what's coming to you. It's a really good idea as well to make them aware of your COVID-19 policy, how the treatment's going to be different, what things are going to be changing.
And it doesn't have to be big, just a couple of points, like a guideline. What's going to happen, how we're going to run the session, just so there's the patients, your clients are not anxious and they know you prepare and you took some steps
Yes.
to make all this session prepare with this what's going on.
Yeah, and give yourself more time. It might mean that you'll have less clients in a day, but that's more important at the moment. You don't want someone in a waiting room where they're going to have to pass the client before. You're going to need time to clean down your sheets and beds and wash your hands and everything in between clients as well. So it's really important to leave sort of a good 15-20 minutes so your client has left and you've got time to tidy before your next one arrives.
Think as this as a easing off into the full-time calendar when you can see nicely clients, just a couple of clients at through the day, just even the first week, just so you get this practice and see what's happening.
Also, it reduces the exposure. So if you were to come in contact, you're going to be seeing less people, so it's less spread. I mean, fingers crossed, we're all going to go out there and be safe and well and take all the precautions, but there is that element of fear still, obviously. Also, you will need PPE, be it a mask or offering clients masks. This all costs money, and you're going to have more cleaning and more antibacterial things. Don't be afraid to up your prices. We were discussing maybe £2 a client or thereabouts, but you can do more or less depending on your style and what you use.
And the clients will understand that.
Yes.
And we know already chiropractic clinic, osteopath clinic started, and I've seen my osteopath already, and that's what they do. So that is a new normal.
Yes.
So don't be afraid asking for more money. Clients will understand, and they will even appreciate you more because you're taking those precautions.
Guys, you're going to need to prepare your clinic. Obviously, hygiene has always been really high on the list for massage therapy anyway.
Regardless if it's a virus or not virus, what's going on, we as a therapist, our clinic should be spotless, clean, our hygiene should be there anyway. So we already on the base of a good start.
Yes, but this time round, I would advise you do a complete deep clean. Take everything out of your clinic if you can. Clean everything down and make sure all the surfaces have been anti-bac cleaned and they're all safe again.
Completely in your client, keep only what you need. Minimalism is that's your friend at the moment. So no pretty stuff, no lava lamps. No, I know you want to make session and the place look really nice, but if you can have a minimal, it just makes you think that you don't have to clean that place so thoroughly. It's just a quick wipe around, open up the windows, and that's done.
Yeah. Obviously, you're going to need more sort of protection for yourself and your clients, like we spoke about, putting up the prices to cover that. If you do go down the route of disposable masks and things like this, do think of the environment as well. All these things are going to go into landfill or out into the ocean, and it's something we need to reduce. So if you are able to use face masks that you can make yourself, which we can do another video on how to make these, it's better for the environment, and also you're going to get more wear out of them, so they work out cheaper as well. Another thing is scrub bags. Some of you might have heard about the nurses have been putting out pleas for scrub bags. So at the end of their shift, they can take all their clothes off, put it into a bag, which is usually just a pillowcase. Which way around is it? A pillowcase like this. You put everything in, and you sew elastic in the top to close it. And then the bag and everything.
When you finish the session, grab a couple of stuff,
put it all in, and that can go straight in
Boom.
the washing machine. So you don't need to touch anything. So you can do that with your sheets and whatever you have. You don't have to spend time and put elastic in it. It doesn't have to be fancy. Just a pillowcase, or I've got a lot of these bags that have been given away at different things. These would work as well. You can just put them in there and then put the bag and everything into the washing machine, and job done.
and yeah, you can wash all at the same time.
Yep.
Another thing about PPE is don't stress about it. At the moment, I check a couple of places which they're selling PPEs. They're out of stock.
Yeah.
So even if you want to prepare yourself, get this, get all lots of stuff, you might don't get them. Obviously, it was like in the beginning COVID, there was no toilet papers, the shortages, the stock levels come down so you can prepare better. But if you keep things to minimal, don't use the sheets on the table. You can just wipe the table easily with the wipes, or just easy antibacterial cleaner.
Yeah.
Just wipe everything, and it's just easy done instead of doing a pile of washing, preparing stuff, and just have lots of wastage and lots of rubbish.
Also, if you're mobile, you can ask your clients to provide sheets, and then they're the one touching the sheets, and they have to deal with washing them. I mean, you can give them advice if you like, but using their stuff will keep them safer.
As a mobile massage therapist, at the moment, in the first month, in the first few weeks, I'm just gonna go with the bare couch.
Yeah.
That's it. I'm gonna use their own and just the cleaning products. They're gonna use their own towels if they want to, possibly oils, and that's how I'm gonna work. And that's what it is. Yeah. And I'm okay with that. And that's why it's a good preparation beforehand when you talk to the clients, to let them know what's going to happen.
Yes, obviously it is going to be different from how it's been before, but hopefully this won't be forever. It's just a precaution for now. But most important thing to remember is you don't have to do anything you don't want to do. Don't overthink things.
Don't panic.
No, don't panic. If you're not comfortable, your client's not going to be comfortable. And it starts a circle as well of you starting to fear massage, and that's hard to get out of. So if you're not 100% comfortable with treating someone, don't
do it. And it's, remember, in the beginning when you started up, everything was new, everything was different. We were nervous, we were what to do, how to set up, and it will come in the practice. I talked to a couple of friends, chiros and osteo. It was strange in the first session, second session, but for the week it got better because that's the new normal.
How was your osteopath treatment you said you received the other day?
Yeah, I went to the osteopath. Place was nice and clean, all bare, on the couch. He had a gloves, apron and a mask, and I had a mask on my face, and that's it. And that was perfectly enough. It was a bit strange in the beginning, but a couple of minutes into the sessions, it was just feels normal.
Yeah, it was, so you almost forgot what was
what was going on, and the treatment worked.
Yeah.
My next move. So how to run your session? So clients already here and what to do. So give you a couple of ideas.
Yeah, basically, research has said that if you're facing the same direction as we are, there's less risk because you're not breathing towards that person. So you are able to get a little closer because you're facing the same way. So with that in mind, think about treating your client prone as much as possible. There is a lot of work you can do, sort of like on your quads, even when you're prone. You don't have to work the other way round.
Prone, side lying, behind.
Yeah.
It's just so you not interface with the person, directly, at their face.
Yeah, just think outside the box.
And as well, they're gonna have a mask, you're gonna have a mask. I think that's enough protection so you can work smartly around it.
With the masks as well, obviously you can't force someone to wear a mask. Some people could be asthmatic or claustrophobic even, and that might be a fear for them. So that's something you're going to have to talk through with your client to make sure they're comfortable. And if you're not comfortable treating them without a mask, don't. It's as simple as that.
If it comes to the sessions, there's a couple of ideas. You can work with them with the clothes on.
Yes.
You don't have to have a skin-to-skin contact, which we want, which is very important for not only physical but psychological and emotional level. That's what we do, but you can really do, the clients are not comfortable in the beginning, can work through the clothes. Yeah. Lots of things you can do.
Or a sheet on top to work through if they've turned up in shorts or something like that you don't want to touch skin to skin. Then a sheet can be really beneficial. Even stretches, just bunch up the sheet and stretch through it. It can work really, really well.
So now, if you want to have a contact skin to skin, there's a big argue if to use those ones. there is an argument, and even the surgeons, what they say, you only use the gloves if there is a cut in the skin, if there is a wound, to prevent the infections. If there is not, there's a less likely to spread the virus on the bare skin than actually the gloves. And even if you want to wear the gloves, how are you going to use your elbows? How are you going to use your forearms? This is only my opinion.
Yeah.
If you wash your hands thoroughly and looking after yourself with proper hygiene as you should in a clinic, we don't need to use them. It's not necessary. They're gonna end up in the landfill.
Yeah.
You spend a lot of money, a lot of waste for the people who actually need them.
And they don't really feel very nice on the client's skin. In my opinion, it feels strange.
It's something you can get used to it, but it's your
decision. It's your whatever you feel comfortable. Another idea is maybe to use your massage chair if you have one. I have one I've only used at festivals before, but it is quite a nice idea, I was thinking, especially if the weather's nice. And you'll go into a client's house, you could set up in their back garden or in your own back garden if you've got space at your clinic or wherever you work from. It'd be quite nice, and there's quite a lot you can do on the chair. There's some YouTube videos you can have a look at. You can actually work into the legs as well. It's not just neck and shoulders, although that is, a lot of the time where people want us to work.
And the client's facing away from you. It's easy to carry, it's easy to set up, less to clean. So that's just a kind of idea for you, what you can do.
Also, naturally, people wear clothes when they're on a
massage chair.
So it makes it more normal.
In your place, if you can open a window, that is great between clients to ventilate. Yes, it could be a little bit colder. Hopefully the summer is better and it's nice and warm. You can do that. You can get air purifiers to ventilate the room anyway between the clients. So there's a couple of options.
Yeah, I was going to say about this time last year, I think it was, I was doing a mobile with a client. I went round to her house and the sun was blazing. It was really, really lovely. And she'd opened up the patio doors. So we were actually in like her dining area with the patio doors wide open. And it was really, really lovely. You could hear the birds singing. And
many times as a mobile massage therapist, I work with people in the garden because it was just such a lovely weather. It's really nice. And just let's do a session there. Why not?
I mean, it's safer for us as therapists, but also I think it adds to the therapy. It's really relaxing. It's nice, as long as they don't have hay fever.
Yeah, that won't help, or not when it's raining.
Yeah.
Unless I had one session when it was really nice weather and this cloud came really, really quickly and started to rain. But so
was that just over your head?
It has happened. So, but yeah.
But sometimes I think that adds to the experience and it makes it a more memorable experience. And as long as you go back in and clean everything up and dry off and treat, it's all fun.
It's all fun. So guys, it's a lot to think about it. It's a lot of preparation, but it have to be done. And it's really good idea to practice this beforehand. Set up the clinic a couple of times. See your family members. See how that works. What doesn't work. Move things around. Make sure you have hand sanitizers on hands, things like that. If you have a capacity to get them, if there's idea to just keep it for yourself and ask clients to bring their own masks, or you can also set up the place when if they don't have one, you can provide them for extra £2 or something like that. It's a lot to think about it.
Yeah.
But don't stress about it.
There is quite a few places that are made. I mean, I've made these, but if you're not into making things, there's a lot of people around that are selling them on social media sites, and I think they're buying them for about £5 or so. So you could buy 3 or 4 and offer them to your clients for the price you bought them at, and then they can have them every time they come. They've got their own mask. I was going to say, it doesn't have to always be a mask either. There's like the bandana that you had there, or a scarf that that's what government guidelines have said. So just to think logically about
Give me your money.
what can be done. But I think the idea as well of using friends and family is really, really good, because that's what we did when we first got qualified. We used family and friends to practice on. So maybe go back to that idea now and practice on them, get their feedback. Did they feel happy and safe? Did you feel happy and safe?
Another tip, if you use reusable mask, the blue side's going outside. Just a tip.
Yeah. That is, yeah.
Yeah. I lost the bet, so now I know. But guys, if it's this all overwhelming and you're not ready, you feel like you have a family member you need to look after, they have some conditions which can cause some effects, don't rush. You don't have to open your clinic yet. Maybe yes, financially it's not good, but it's not worth the risk. Yeah. And just wait another month. Maybe you can start seeing people in August, a little bit later, if there's a possibility. If you don't want to rush, I know lots of people said, you know what, I'm not gonna fluff. I'm not gonna play with all of this. Not just because of the financial reason, just because it's just a lot of things. I just want to have a nice contact with people. I'm gonna wait.
Yeah. Just because you're allowed to open doesn't mean you have to open. It's got to be your decision. And like we said before, if you're not comfortable or you're feeling nervous, your client is going to feel that. So make sure you are ready to do this first.
Really important is pure, clear communication to your clients, regardless of what you do, in email, in phone calls, so they know they're there. I bet many of you clients were asking already for a month. Are you open yet? Are you open yet? Can I see you? Clients are there. Clients keen to come back to you, so you're not losing it. You will see. You will have a busy diary very soon. If you're not comfortable still opening, offer some Zoom phone calls. Yeah. Do the stretches with them. Yeah. Show them self-massage sessions, stretches they can do. Yeah. They can give you some, half price for that. But you can spend half an hour with them, and that's already a good start.
Definitely. Maybe they live with someone that you can guide to, do a few simple treatments. Even, rocking of the shoulders, which helps to just loosen things up. You're not going to lose a client by showing a few tips and tricks, but it's going to help them sort of relax a bit more, work on any injuries. So use what you have. If you don't want to see them face to face, yes, look at Zoom or Skype or WhatsApp, whatever means that there is. And yeah, when you've got things to tell them, it might be clearer. We'll put some bullet points together for you, and you can feel free to copy that, alter it any way you want, and send that on to a client. So they've got it in black and white, exactly, nice and precise things that you will expect and what you will be doing for them as well.
We are community, we are friends. Contact other massage therapists, ask in the groups what other people do, how they're preparing. But don't feel you have to do the same. Yes. Everyone's different. Everyone have a different financial ability to get all this stuff. Some people don't. So working with the simple bare minimum that's fine. And remember, clients will understand that. Yes. They know what's happening. They know what's going on. They're just keen to come back to you.
Yeah, definitely. And also, if you do work alongside another massage therapist that you are friendly with and you don't want to go back to work yet for whatever reason, but one of your clients in chronic pain and you feel that pressure, speak to your other massage friend to see if maybe they could, if they've opened their clinic, could they take on that one client until you feel ready.
Have a friend, practice opening, practice clients coming on to the clinic with all of this. Have a one session swap. See how you talk through. What would you do? What would you do different? That's very important. We are a community. Yes. Post your questions. See what you think. Hopefully that video was helpful. And guys, really nice to be back in touch, doing videos for you. We are there for you. and there'll be some more exciting things coming up very soon. If you have any questions, post them on our social media. We're gonna try to answer them.
Yeah, or if you've got any other tips and tricks that we've missed, we will put the bullet points together. But if there's anything you think of, put the comments in the bottom. We can add them on for all the other therapists as well.
Guys, stay safe, be amazing. You are amazing. We're gonna go through it and gonna be back to normal.
And wash your hands.
And wash your hands.
Bye-bye.
Bye. Nice. No.
You're welcome.
Cheers. Don't mention it.
It's probably a good job.
Yeah.
I know, that's not a good start, is it?
No. I'm stimming.
That's better. I was just thinking you pressed record and I was like, I should have had a drink first.
Nice, yeah, good idea.
Yeah,
Yeah,
it's popped in my head now,
No,
sorry.
no, good. Yeah.
What for? Blah. I'm going to start again.
Don't forget to do blah.
That is very important.
Blah.
That's the exercise.
Blah.